Is diazepam safe to take while breastfeeding? When it comes to managing anxiety and PTSD, many mothers wonder about the safety of medications like diazepam during breastfeeding. Diazepam is a benzodiazepine often prescribed for anxiety relief. However, its use while breastfeeding raises important questions. Diazepam does transfer into breast milk, albeit in small amounts. The concern is that diazepam has a long half-life and can create active metabolites in the body. This means that if a breastfeeding mother takes diazepam regularly or in higher doses, it can build up in the infant's system. This accumulation can lead to sedation in the baby, making them excessively sleepy. Such drowsiness can interfere with feeding and potentially affect the infant's weight gain. There have been reports of breastfed infants experiencing poor feeding and weight loss due to exposure to diazepam through breast milk. Because of these risks, long-term or repeated use of diazepam while breastfeeding is generally not recommended. However, short-term or single-dose use may be considered safer under medical supervision. Mothers who do take diazepam while breastfeeding should keep a close eye on their infants for signs of excessive sleepiness, difficulty feeding, slowed breathing, or poor weight gain. If any of these symptoms arise, it is crucial to seek pediatric care promptly. Health organizations like the World Health Organization suggest that diazepam can be compatible with breastfeeding if used as a single dose. However, they advise against repeated doses whenever possible. The American Academy of Pediatrics also notes that while the effects on nursing infants are not fully understood, prolonged exposure could be concerning. For mothers dealing with PTSD or anxiety, healthcare providers often recommend alternatives to diazepam. Medications with shorter half-lives, such as lorazepam or oxazepam, are less likely to accumulate in breast milk and pose a lower risk to the infant. Additionally, there are alternative medications that may offer effective symptom control while being safer for breastfeeding mothers. In conclusion, while diazepam can be used cautiously during breastfeeding, it is generally not advisable for long-term use due to the risk of sedation and feeding issues in infants. Decisions about using this medication should involve a careful evaluation of the benefits for the mother against the potential risks for the baby. It is essential for mothers with PTSD or anxiety to consult their healthcare providers to explore safer treatment options that are compatible with breastfeeding.